Hello, good morning, America. Good afternoon, Europe and Africa, and good evening, Asia and Australasia. We are back for this special episode of ISRT Facebook Live webinar. And this week, we are very happy to have a collaboration between the ISRT and the Japan Association of Radiological Technologists to host this special series of the webinar on artificial intelligence. And the topic of today is the overview of the current status of artificial intelligence or AI surrounding the field of radiological medical technology. And first of all, I would like to ask our president, Donna Newman, to give an opening speech for this collaborative project with the Japanese Society.
Good morning, good afternoon, and good evening, my fellow ISRT members from around the world. I'm very excited to bring this program to you. This is our second one in this series and our first time hosting within the Asia-Australasia region. And we're very excited about hosting with the Japan Society. Thank you, President Kazuhiko Ada. I really appreciate working with you on this project. You are great leaders in the field of AI, and we think that you have much to share with the rest of our members around the world. I'm looking forward to the presentation. Now, for those of you that are beginning your celebration for World Radiography Day, some people celebrate for the entire week, some people celebrate for the day, but I'm excited about celebrating this week for World Radiography Day, and anybody around the world that needs a poster to use, please go to the ISRT website under communication and download our World Radiography Day poster. And please share that on your Facebook page. Take some pictures with you in it. And if you do, we will share them on our website or on our Facebook page on World Radiography Day. I would like to turn over the mic now to the president of the Japan Society for a few words to our members. Thank you.
Hello, my name is Katsuhiko Ueda, President of the Japan Society of Radiological Technologists. This year, June, I was elected the President of JRT, so I guess most of ISRT members will not know about me. I'm happy to your colleagues. First of all, I would like to express my deep sympathies to those who have died of new coronavirus infection, and I'd like to gratitude to all my fellows. In the face of difficulty of global spread of the new coronavirus infection, I guess it is a very difficult year. In this situation, I'd like to express my sincere respect for President Donna Newman's efforts. On behalf of JRT, I sincerely congratulate you on the World Radiography Day. I'm honored to be with you today. In Japan, we have approximately 55,000 radiographers and radiological technologists working in hospitals and clinics. We provide various technologies, but in Japan, the clinical application of artificial intelligence technology is still few. Today's speaker, Dr. Yamamoto, was a radiological technologist in Japan, but now he is a researcher and a company owner. This is a unique career in Japan. I'm looking forward to his talk. Finally, I would like to express my expectation for the further growth of ISRT and the success of clinical, educational, and research by all participants. Thank you very much.
Thank you so much, President Ueda, for first of all for your collaboration with the ISRT and your presence here to give the opening speech. And from now, I would like to take the opportunity to introduce our speaker, Dr. Shuji Yamamoto. Dr. Shuji Yamamoto, he is Hello, Dr. Yamamoto. Dr. Yamamoto is currently he is the founder and CEO of Lizard Company Limited, based in Tokyo, Japan, and also CEO and founder of Textile Craft O, and it's based in Tallinn in Estonia. Very impressive CV here. Dr. Yamamoto graduated in radiological technology. He's a technologist or radiographer like us from Osaka University in 1992. And then he furthered his education in the same in Osaka Kyoiku University and got his master's degree in physiology. And in 2003, he finished his PhD doctoral degree in medical physics from Osaka University. And he has a lot of experience in terms of teaching research. And now he become a CEO of a company. And this is a very impressive CV as the radiographers or technologists like us. And today, with the collaboration with the Japanese Association of Radiological Technologists, we would like to welcome Dr. Yamamoto to give a presentation in the title of Overview of Current Status of Artificial Intelligence Surrounding the Field of Radiological Medical Technology. Please welcome Dr. Yamamoto.
Good morning and evening, everyone here via the internet. I'm Shuji Yamamoto, speaker, Japanese company CEO, Legit, and Textile Craft in Estonia. Thank you very much for coming today for our memorial speech about overview of the current status of artificial intelligence surroundings the field of radiological medical technology. I would like to begin with starting my sincere condolences to those we lost in our fight against the COVID-19 pandemic, and solidarity toward those who are still battling on. I also would like to extend my appreciation to the healthcare professionals on front lines. I pray for the earliest possible recovery of all COVID-19 affected people. In this presentation, the conflict of interest declaration of this presentation is shown on this slide. Now, let's get into the main subject. But when does the word artificial intelligence come into being, and what is its definition? According to my internet research, John McCarthy, who coined the term in 1956, defined it as the science and engineering of the making intelligent machines. Artificial intelligence is the theory and development of the computer system able to perform tasks normally requiring the human intelligence, such as visual perception, speech recognition, decision making, and the transaction between languages. This definition is now divided into weak and strong, which is categorized as a weak artificial intelligence. So, how do we have the potential, such as the technology, actually give a change in our environment, including the artificial intelligence The display of the half cycle is very interesting. Whether the latest technology is in realistic or overreacting stage can be seen in a diagram like the Gartner hype cycle. The hype cycle is a diagram showing the maturity level, adoption level, and social applicability of the specific technology. Gartner coined the term. According to the Gartner, the hype cycle consists of the 5 stages. 1. The innovation trigger. 2. Peak of the inflated expectation. 3. Trough of disillusionment. 4. The slope of enlightenment. 5. The plateau of productivity. It's interesting to note that almost the artificial technology are on the stage of innovation trigger and the peak of inflated expectations. The key technology word announced in August of this year suggests the potential for the technology during and after the COVID-19 pandemic. For example, the social distance technology, health passport, differential privacy beyond your own identity, and so on. It seems to be an important factor technology from the 2020. On the other hand, looking at our industry, we can understand the development of the imaging processing capabilities by looking at the historical transition of medical images. Since the advent of the X-ray radiography, CT has archived calculation and visualization of tomography of the whole body. The advent of the multi-flash CT was an innovative technology that allowed high reconstruction speed and the ability to display the entire body in thin slice. In addition, the computing power of general purpose personal computers have been explosively improved by Moore's law, and from 3D of surface patch only on the surface to high quality photorealistic 3D-dimensional volume rendering is now showing beautiful images. The 3D images are used for screening for colorectal cancer, such as VGP display of colorectal coronography, by converting and transforming them. Furthermore, because 3D images have analytical and quantitative significance, they are also used as a parameter for artificial intelligence, and nowadays, the 3D region detection system that employ regulatory approved deep learning have appeared. By monitoring quantitative indexes such as the size of detected lesion, artificial intelligence can support the confirmation of the sustainability of the effect of the anti-cancer drug and the timing of the surgery. If you look at the entire working environment of the radiologist and the radiological technologist, first, we touch the electronic health record or radiology information systems display. Artificial intelligence is already used for the patient matching, like a patient information in database system. The modality in which patient information is automatically set by using the DICOM work list function has also appeared in a machine where artificial intelligence applied to generate low noise, high resolution images at the stage of pre-processing by image reconstruction. There has been a desire to reduce radiation loads in computed tomography. As dependence on computers has increased, automated method for the identification and processing of other predefined feature collectivity known as a computer-aided detection. This is called CADE. On the other hand, the method to automate diagnosis collectivity differed to other computer-aided diagnosis. This is called CADX system. Several systems are already in clinical use, as is the case with screening cancer, like the brain cell abnormality. In Japan, the LPixel company has received the regulatory approval for Japan's first deep learning cerebral aneurysm detection program. The next step is analysis called radiomics. Radiomics is a method for the comprehensively interpreting disease by fusing pathological data and genomic data other than the image used for the radio diagnosis and analyzing the correlation. Ultimately, it will output the report of the diagnosis and the treatment progress. But AI is also used here, such as AI dictation and the voice recognition logging system, like a security performance system. These will also return to the electronic health record. Since artificial intelligence is strongly expected for the image recognition, it has become the place to sell artificial intelligence in the medical device industry market. How fast and highly accurate region can be detected, price, money, competition have become popular. And the number of startup companies and the other promotion company has increased rapidly in the medical imaging industry. This cost map often shows the surge. As a radiologist, in the clinical setting, it is easy to notice. For example, if you just wanted to find out a disease, it may be available for screening, but it is doubtful whether it is surprisingly attractive. If so, CADE should have succeeded in the second artificial intelligence boom. In reality, if you want to improve the efficiency of work itself, such as changing time series and the nature of illness, the cost effectiveness may not improve unless automatic interpretation report generation is possible. As I mentioned in the previous slide about the hype cycle, AI is expected to be over-expected because of the influence of the science fiction movies. But in fact, the artificial intelligence currently in use is deep learning. However, only what is called weak artificial intelligence is widespread. The weak AI, in some research, the computer are used as a tool. I don't claim that the computer itself is the heart. It can be used for the specialized task. That is, image recognition, image classification, predictive classification, and image generation technology called GAN. For a specific problem are also specialized with artificial intelligence. On the other hand, the strong AI, if you program your computer in the right way, that is what you think. In other words, AI is strongly tackled with a view that if you upgrade your computer and improve your algorithm, you should be able to act autonomously like a human being. Since such a strong AI has been archived at present, I don't think it is necessary to worry too much about AI taking job. Using artificial intelligence, it is also possible to classify image and read characters. In a familiar example, when taking a picture of a person with a digital camera, measuring the body temperature using the face recognition function is used to identify the person who may be infected with COVID-19. With medical image, for example, it has become possible to detect tumor in mammography and classify them as a benign or malignant based on the characteristics of the tumor. In addition, by accumulating time series data, it has become possible to realize a predictive medicine. As a unique method of the artificial intelligence, the generative adversarial networks, GNN, may be used when there is a little training data, as mentioned above. The Armed Hosni in Harvard Medical School write that there are two classes of the artificial intelligence methods that are in wide use today. The one is machine learning. The machine learning that captures the characteristics of input data, rule it, and automates it. The machine learning is not fully automatic because the characteristics are taken by the human each time. The deep learning is an advanced method of the machine learning and can be said to be a type of the machine learning. The deep learning is based on a technology called a neural network that imitates the mechanism of the human nerve cell. This makes it possible for the deep learning to derive the correct answer through a process that is very similar to the human cognitive process. So, deep learning called end-to-end machine learning. So, is the research process correct for the artificial intelligence research, generalization of AI, and high-quality AI research? How does a reviewer look at the criteria? According to the author of this figure, we should know the 9 part of the review point. The pick up some important point. The one is carefully define all 3 images set, training, validation, and the test set of image of the artificial intelligence experiment. The training algorithm is tiny and validated on a separated set of the images. Finally, independent, the test set of the image is used to report final statistical results of the artificial intelligence. Ideally, each of the 3 sets of images should be independent without overlap. 2. The use multi-vendor images, preferably for each phase of the artificial intelligence evaluation, about the training, validation, test data set. 3. The train the AI algorithm using the standard of the reference that is widely accepted in our field. 4. Describe any preparation of the image of the AI algorithm. Preparation and annotation of the image greatly affect radiologist understanding of the AI model. The manual cropping of the tumor feature is a standard in radiomics study. Such studies should always evaluate the relationships of the size and the reproducibility of the cropped volume, the final statistical result. 5. The benchmark the AI performance to radiology expert. The results frequently compare one artificial intelligence to another based on the area under the receiver operating characteristics AUC from the ROC curve. So if students want to run artificial intelligence, and if they are interested in the programming, computer programming, I personally recommend it using the Python Jupyter Notebook or MATLAB. Nowadays, video-like procedure can be reproduced according to the author's operating procedure. Ebooks like the Kindle and have a many explanatory textbook and video training such as Udemy has helped to speech things up in recent years. Please see the video. So if you really want to experience artificial intelligence segmentation using open source software rather than commercial use software, for example, you can use the NVIDIA's Clara annotation engine as shown to the successful segment small with a minimum of the 6 clicks around the tumor. After successfully removing the tumor, it is also possible to extract hundreds of the 3D texture feature of the tumor with a plugin called PyRadiomics. According to the NVIDIA, the NVIDIA's Clara is an open and extensible computing platform that allows developers to develop intelligent devices and generate automatic medical workflow in hybrid, embedded, on-premise or cloud computing environments. It's explained that you can build and deploy medical image processing application. The cloud, the platform aims to leverage advanced in other industry proven technologies such as gaming, autonomous vehicle, and cloud computing in the medical image industry. So in this slide, I will introduce software that can analyze by using the special feature only for lung cancer that I developed and the image analysis feature that were applied for the general purpose and judge benign or malignant from a quantitative analysis. The disadvantage of this software is that it is the standalone and does not run from the huge database into the cloud, but it calculates the characteristics index of the specific cancer with the various high impact factors. So it is a parameter for the metastatic learning, metastasis learning of other system. It is effective when increasing the number. Thank you for attention. So this slide explanation, by Huey medical system, one of our partners that meet all medical imaging workflow rather than the standalone one mentioned earlier. Huey Medical have developed an all-in-one type artificial intelligence supported radiomics that many researchers use to research radiomics and radiogenomics. Here, I won't go into the detail of the sake of this time, but machine learning allows you to compare all 6 algorithms that is the support vector machine, logistic regression, k-means nearest neighbor, decision tree, random forest, the XGBoost. The ROC curve is automatically displayed of the evaluation of learning. What is unique is that it automatically writes method for the pseudo academic paper. So, as a final point in this presentation, the disease monitoring is essential for the diagnosis and assessment of the treatment response. Artificial intelligence is not only detect lesion, but also automatically measures the change over time, predict the safety and the effectiveness of the treatment effect, and plays an important role in the surgery and the change in treatment policies. Of course, in this case, the strict verification of artificial intelligence itself is also required. And AI will play an active role as a second opinion. In order to judge the therapeutic effect, a test modality with high sensitivity of each disease-specific property is selected. And it may be difficult to monitor not only morphological changes, but also functional change and the lesion only with a specific modality. The image evaluation method selected differed depending on each disease, and the name of the criteria also changed. The most representative is a criteria called RECIST 1.1, which is used to determine the therapeutic effects of the solid tumor. Since RECIST 1.1 mainly monitors the size of the tumor, it often cannot completely reflect the effect of the treatment, depending on the disease. Reno criteria for the malignant glioma, iRECIST for the immunotherapy, etc. It also selected iRECIST is a relatively new and international method of the therapeutic efficacy monitoring. This is a software called Mint Region, developed by our partner Mint Medical, headquartered in Heidelberg, Germany. With this software, not only region at the one-time point, but also the same region or a new region can be analyzed and tracked by the deep learning from the multiple time series data. The follow-up results are output as a report, and more detailed individual region data can be output in the format of the C-disk format. Then now I would like to get into knowing our environment about the artificial intelligence. In order to use AI, artificial intelligence, the three major technical foundations like slide are required. That is the high-speed network infrastructure, the speed of the internet like the 5G, use of the cloud, the large capacity device data required from the learning the big data. The future considering from the big data to the small data is very important. The third, 3 point. The widespread use of the hardware such as a computer and a smartphone with high-speed computing power. Artificial intelligence is just one tool, and it will lead to precision medicine as a whole. In medical care, only evidence the trend to be emphasized, but the idea is old. And the medical care that maximizes the value of the individual patient is mainstream in modern times. It leads from the VBM to precision medicine. This is the final slide. That step, the AI detection, the calculation, monitoring, and the classification, the final CDS, clinical decision systems. We must always keep in mind that we can be patient as well as healthcare providers. This can be seen in a sudden appearance of the COVID-19 this year, which drastically changed the world and shocked it. It's time for us to unite with everyone in the world without stopping and thinking about how we can interact with new technologies. Artificial intelligence is one tool, and as I said in this talk, the things like the science fiction and fantasy cannot happen. Let's explore individual issues from the new standard, improve them, and do our best on both the medical side and the potential patient side. Thank you very much for your attention.
Thank you so much, Dr. Yamamoto, for your very, very comprehensive lecture about artificial intelligence. I have learned a lot from you. And then also, I believe our radiographers and radiological technologists colleagues from around the world also learn a lot from you. For the audience from home, if you have any question for Dr. Yamamoto, please type your question on the question box or the comment box right beneath the screen on this Facebook platform. It's going to be either underneath the screen or on the right hand side. Dr. Yamamoto, I have some questions for you previously asked from the audience from our Facebook podcast. The first one is, do you find a radiographers or radiological technologists in our practice involvement with the artificial intelligence?
I think that what is the meaning as a standpoint of the radiological technologist? So yeah, how to relate it to the artificial intelligence is very important. But as my presentation, I think that too much fear about the development artificial intelligence because of the still, so all artificial intelligence is task-based. Yeah. So as you know, when the old age and from we already experienced from the film-based radiology, and so to the PAC system, the film system. The most of the radiological technologists and the radiographer is a well understand and the change to the digital world very fitably. I think that this is the same things. Yes, so the PAC system is very so familiar with so collaborative artificial intelligence. I think that so the radiological technology as radiological technologist and the radiographer, I think are very familiar with very fitted, very applicable to the next artificial intelligence task-based workflow. So it's very useful each other, I think.
All right. That's quite interesting because from what we have learned so far, especially from my side, from our side, for practical point as technologists, when we deal with the patient, now AI even come in for the patient positioning. And a lot of time that we fear that AI may somehow they won't replace us, but somehow they come to help us. But maybe the workforce may need less number of radiographers with this assistant of the AI. What do you think about this?
The AI. What is the AI?
Yeah, the artificial intelligence now help us with the positioning of the patient, like in computer tomography in CT. Now we know that we need to position the patient right at the ISO center of the couch and the CT scanner, so that the automatic exposure control will doing right thing, right? And AI will come to help by having a camera attached to the CT system and do pattern recognition and help us position the patient. And a lot of us may be frightened a little bit about maybe the workforce or the hospital may reduce the number of radiographers. Instead of hiring 3, maybe they hire 2 or something like that. What do you think about this kind of situation?
Yeah. So I already did talk about see about the Gartner hype cycle. So recently I introduced the social distance technology. Like for example, the Siemens, the single is the cockpit system in the all remote the scanning system. I think that this is not treating to the radiological technologist or radiographer, because like you, the Professor Ponopa, so you are very well understand that how to keep raw the radiation dose with so the high quality image. So the any CT scanner vendor is developing. And so of course, and the AI is still task based. All checker is by the radiological technologist and the radiographer. Yes, yes. And so I would like to the sandwich. The radiographer is also previously check already so the previously check image quality or the protocol is good or not good. And then the second opinion, artificial intelligence is so the horror. And so of course, and one more, the final check as so the radiological technology to radiographer. I think that so sandwich AI is very important because of the skills. So called this is not realized about the so the not appear in the responsible artificial intelligence. You know?
Oh, yes,
Yes, yes. So always so the not we managed by the artificial intelligence. We RT the manage the artificial intelligence like from the film to the frameless. It's a smoothly. I don't need so the not so afraid to the so the yes,
Yes.
artificial intelligence.
I strongly agree with you because professionally, AI come to help us. Not they work for us, not we work for them. And in reality, when we work with the patient, human touch is very important, right?
Yes, yes, yes.
I got another question from our nuclear medicine colleague because in nuclear medicine, we have automated processings for many years, but it does work all the time for them. In their opinion, do you find any roles of artificial intelligence that coming in nuclear medicine in terms of automated processing to make them more accurate?
So about the nuclear medicine.
Yes.
Yeah, it's so. I think that so the always so the technology from the nuclear medicine to the diagnosis, the image like CT because of the iterative reconstruction. Is so the very old days is the first from the nuclear medicine.
Yep.
Yes, yes. So I already saw the try and challenge from the based on the nuclear medicine and then the morphological image to the computed tomography. Yeah, I think that so that this one of my personal the automatic or some we collaborated and so one of the interesting my personally is radiomics. The nuclear medicine like the functional image and mix with the morphological the CT. Also the hybrid and the MRI. And additionally to the genomics or also the like the clinical data is all the mix is also the very good position. There is a very good position in PET or the SPECT or the very functional image. But so I don't know the single single nuclear medicine just only to develop and so the well familiar with AI is so I don't not understand or I don't know. But so like a mix is omics is so the my personally interesting.
Oh,
Yeah,
all right.
yeah,
I think
yeah.
proteomic is very interesting and it's kind of new trend, right?
Mhm.
And AI can help us a lot with this in terms of managing and integrating everything together.
Yeah, because of the so as you know, yes, Professor Honapan. So yes, and always so nuclear medicine is very so well connect with so the drug delivery system.
Mhm.
The radiographer is very high knowledge, the good knowledge of the so the drug and so the not only so the system of the so the diagnosis and the imaging technology, but also the they have a knowledge of the drug and the drug delivery system. So this is where so related in the omics, the radiomics, I think.
Ah, okay.
Mm-mm.
I got one question from Mr. Kim Myung-tin, the president of the Myanmar Society. His question is regarding the radiological report. Do you think some report may have an error using artificial intelligence?
Yeah. So the recognition, so the radiological report system, particularly the DICOM structured report.
Mm-hmm.
This is so many company is a very concentration to developing using the DICOM structured report with artificial intelligence. This is yes, this is a very so important topics. Yeah, yes, and so I'm not detailed, but so dictation system on always so the combination, the reporting with the dictation knowledge, and so the always so this the you connected and radiology information system, the PACS system. So this is a very important technology, and so the near future, and so the so many company not only detect CAD-E, but also the next step and the diagnosis. Finally, to so the automatic and so the making and the diagnostic report. But so doctor also the just AI is one of the two. Doctor is a check.
Yep.
And so the doctor is so the changing the some dictation system using the artificial intelligence and the text matching. And so the doctor is finally to select the reading report. I think so this is the best way. And so the near future is up here. Yeah, I'm looking forward to this year in so the RSNA. But so RSNA is so the, yeah. I don't know what I get so the information, how to get the information. Very interesting area.
Yeah,
Yes.
we do miss the physical conference, and then we miss our friends, especially in the Asia region where we have conference every month in the second part of the year, and we can't have it now. So in case we have any more questions from the audience, and I would like to check. Donna, have you seen any questions from the audience? Unmute your microphone, please. Donna.
Mike.
I don't, but I do have a question. It was just an amazing presentation. And I'm just curious, in all the committees the ISRT has been working on with IAEA and the WHO, a lot of attention has come with dose reduction and about how can we reduce the dose to the patient and about how do we see when patients have multiple procedures done over a period of time. Have you seen a widespread implementation of dose reduction in AI technology and a way to tell when a patient has had multiple procedures over many months? Have you seen much widespread use of this in the AI world in your part of the country?
In my opinion, so the always so work in progress, but so serious and so the clinical decision system is connected to the protocol, any protocol. So mammography and so CT is a sort of checker system. So what is a sort of best and radiologic sequence or taking the picture or the sort of CT scan protocol? What is the best? And so the keeping the low dose and so the not only for the keep low dose and so the high quality image, but also the clinical meaning is already so the computer is already so the check so the like support so the like machine learning or deep learning already so that this is called artificial intelligence supported and the artificial intelligence clinical support system. The support, of course, if this is a success, and after then, and so the most advantage the patient. Yeah, patient is so the no need to the of course and so the over overdose, no meaning without no meaningful protocol. And so, of course, payment is also the keep role. Yeah, this is a sort of trend, but I don't know the sort of best company to give the like the artificial intelligence and clinical decision support system. But this is a very important. I introduce you this presentation from the evidence-based medicine to value-based medicine and patient-centered medicine. Always a value-based medicine related in the healthcare technology assessment. The healthcare technology assessment is a very important work for the radiological technologist and the radiographer. So the healthcare assessment technology healthcare technology assessment is a sort of key word to keep and the low cost and also the low dose, high quality image. Yeah, and so the best benefit to the patient. Yeah, one keyword is this is also the connected the precision medicine. Yeah, like so personalized medicine, like order made medicine. I think. Yeah.
Oh, what a great presentation and the feedback and the question that we have today. And I would like again to thank you so much, Dr. Yamamoto, for your time and your effort to make this presentation for us. And we are so proud that as the radiographers or radiological technologists, we can be a person like you who can be the founder of the company who run the artificial intelligence. That's the big thing for the profession. Donna, you have anything to say before we close the program?
Yes, I just want to thank the Japan Society and our two guests. I think the key of success of the ISRT is its member societies and the experts that we have from all over the world. And I appreciate the opportunity to have this expertise on AI shared with our radiographers all over the world. And I look forward to, in the coming years, collaborating more and seeing what else that we can bring forward to our members about AI. I think it's going to become more and more common language, and I think it will be in the forefront over the next several years for all of us around the world. So I can't thank you enough for joining us and doing this joint session. It's just been a huge success, and I appreciate both of you very much.
Thank you, Donna. And President Ueda, we would like to hear something from you before we close the program.
Okay, thank you very much. I appreciate today's webinar, and I'm very glad to see you. So in Japan, we will be used to the MRI reconstruction by using AI technology. So we will hope the very short time scanning by MRI. So we can get many examination in one MRI machine. But if that's the situation, the radiologist will have to read them a very, very big number of images. So we need also the very high quality computer-aided diagnosis system by artificial intelligence. So I hope that kind of technology in the commercial field soon. Thank you very much.
Well, thank you so much for your both, Dr. Yamamoto and President Ueda. And next week, next Sunday, November the 8th, we will celebrate World Radiography Day together. And the theme, again, will be on artificial intelligence. And the theme for World Radiography Day in 2020 is radiographers are essential in elevating patient care with artificial intelligence. And I hope to see you guys and the audience around the world. Next week, we will celebrate World Radiography Day together. And thank you so much for today. And have a nice day, everyone. Goodbye.
Thank you. Bye.
Thank you. Bye-bye. much.